Okay, 10 seconds. In 10 seconds. Hello and welcome, viewers. You are watching the Policy Times exclusive show, India Policy Show. It is a show where we do every day at 1 p.m. to 2 p.m. India time. We come with a group of experts and we discuss on a very pertinent and important topic. COVID-19 is just not any ordinary incident in the world. Just like World War One, World War Two changed the shape of this world, COVID-19 would be considered as such unprecedented time when the world would be divided into two parts, the pre-COVID era and post-COVID era. And I think one of areas which is going to have excessive and tremendous importance would be sustainability and environmental issues and climate change. And that's why Policy Times, in partnership with Micropolitan Research Center, Faculty of Civil Engineering and Built Environment at UTHM University, based in Malaysia, we have together joined hand and started this series of discussions where we invite environmentalists, climate change companies, or environmental companies working, waste management companies working in this field, academia as well as industry, balanced manner, bringing them and finding solutions for this. Today, I'm very happy to welcome Dr. Eslina as my co-moderator to kindly take over this session and moderate this session and introduce the speakers. Dr. Eslina, can you kindly introduce yourself and take over the session?
Okay, Assalamualaikum and good day everyone. I'm Eslina Abdul Kadir from the Faculty of Civil Engineering and Built Environment from UTHM. I would like to thank Mr. Akram for inviting me as the co-moderator in this Indian policy show to discuss the title on COVID-19 and waste generation. Will there be a new normal? I would like to appreciate all the panelists' time here. Despite their busy schedule, they are willing to join in, and I hope that all the viewers will gain some insights on the waste issues. So without further ado, I would like to introduce our panels today. The first one is Dr. Muhammad Fauzi Muhammad Taha. He's the ex-deputy CEO of SW Corp. He's started to work at Public Work Department as project engineer, then contribute at Ministry of Health from 1990 to 2009 as public health engineer, and finally worked at Solid Waste and Public Cleansing Management Corporation from 2009 to 2020 and retired as Deputy CEO. Our second panel is Prof. Razman Salim from Civil Engineering Department, Faculty of Engineering Technology and Built Environment, UCSI University. Previously, he works at University Technology Malaysia for more than 30 years till April 2019. He was also appointed as one of the members for a task force in waste management issues for Academic Science Malaysia. And our third panel is Prof. Insinyur Dr. Muhammad Fadil bin Madin, the Director of University Technology Malaysia Campus Sustainability. He is actively participating in environmental nexus work under energy, climate change, waste management and wastewater application. He is also joining Asian Science Diplomat to establish the youth and sustainability network within country and also contributing significantly any efforts towards sustainable development goals. And our fourth panel from the industry is Dr. Sivapalan Kathiravel. He is the head of Environmental Preservation and Innovation Center and also representing Quality Alam today. Dr. Siva has over 20 years of experience in the waste management field and currently heads the newly established Center of Excellence for Waste Management in Malaysia under the patronage of Sembiro and Khazanah Nasional. He is also one of the 5 non-chartered waste managers in Malaysia in establishing the first refuse-derived fuel plant in Malaysia with a commercial value of 150 million. So we are going to talk about our topic today. I have my personal opinion because I'm also someone which involved in the waste field. I think in the waste management during this period of the COVID-19, there are 3 priorities. The first one is to ensure the continuity of the services. We have to recognize the essential role of the waste workers and also services, but at the same time, we have to ensure the health and safety measures for the waste workers. The second thing or second priority is I think we have to adjust on the recycling services because this manual recycling maybe will lead to cause cross contamination and also infection. And priority number three is to ensure safe collection, disposal, and also treatment of healthcare waste because this waste is increasing and we do not want to risk for further infections as well as pollution. So maybe all the panels can give a remark points on what should be the priorities for waste management during this COVID-19 pandemic. Maybe we can start with Dr. Fauzi.
Okay, thank you, Dr. Azrina, and very good afternoon. Assalamualaikum warahmatullahi wabarakatuh. I'm glad to be part of this today panel discussion. For information, the solid waste management and public cleansing are already listed as one of the essential services under this Malaysian MCO, Malaysian Control Movement Order. So therefore, the services need to be carried out. Hmm? Meaning that we need to provide the service of this solid waste management and collection and disposal of solid waste. Because solid waste is very important, this is one of the element factors that contribute into the public health. So we need to maintain the cleanliness and also the solid waste. However, during this MCO, we call it MCO here in Malaysia, we need to do some extra effort. For example, we need to ensure that our workers are in a good health. So therefore, every morning during the roll call, the health situation of our health condition of our workers need to be checked. Those who are not healthy or some fevers or some have any symptom, they are not allowed to take part of today's works. And at the same time, they need to wear the proper PPEs, the full PPEs, beside the face mask. And after the collection been done, all the vehicle and equipment need to be sterilized, or not sterilized, disinfect or sanitize to ensure everything cleans. And we also advise our workers to take extra cautions so that in ensuring that they are not infected with anything. For example, they are not allowed to touch the garbage. And we also encourage people to put all the garbage inside the plastic bags. And we also advise our workers, besides not touching the garbage, they need to use our already equipped bin lifter. Meaning that whatever garbage inside the bin, they need to lift it into the compactor without touching it. So this is some extra effort we introduced during the MCO to ensure that our workers is protected. And at the same time, we also supporting the government in doing the sanitizing at the public places, identified by the Ministry of Health. For example, if certain area identified as the infected areas, we help them in doing sanitation for at the public area, for example, at the bus stop, children playground, and so on. So this is some of the initiative that we doing during the MCO. As I mentioned, this is essential service, so the service need to continue.
Okay,
Thank you.
maybe Prof. Razman can add on from a view of academics.
I think maybe what we can see here, COVID-19 crisis has become a very part of the society at the moment, and we can see this has actually put a lot of stress and exerting pressure to the economic activities, and this also include those that are indispensable to our well-being. We need to protect the life and livelihood at the core of all the action and decision to address this crisis. So we actually need to have a proper waste management, which is very essential services to the society. So what we can see here, we need to sustain the effort necessary for this continuity of the waste management activities, which include all those separate collection and recycling, which are actually essential to the circular economy. And those efforts actually involve preventing or reducing disruptions due to shortage of staff, ensuring enhanced and health and safety at work, providing for safe handling of household waste, and that is being produced by the citizen, more so now during the COVID-19 incident where some of the citizens are being affected and are positive COVID-19. So they do have a lot of waste that are much involved in the healthcare waste. So there exists a certain segregation needs between the household waste, that's the municipal household waste, and the healthcare waste. And this need to be looked into. And this is actually affecting the workforce. And the workforce or the waste management need to adapt to a new approach for the continuity of these waste services. So I think there's a lot of ways and methods that need to be carried out in order for the continuity of these waste services. And some have been stated before how we can actually look into these issues of those waste workers who are actually the frontliners, where we can see part of the system in the waste management could be done at home, but a majority of them have to go in front. So they are the frontliners and they need to be protected from this COVID-19. And such protection had to be adopted and adapted by the management system of those services in such a way that they are being protected. And when they are being protected, they will protect us, and then the society at large as well will be protected against this COVID-19 pandemic. So I think we'll talk later about what are some of the adaptive measures that can be done by the waste services. As far as we can see, the MCO now, the movement control orders, and the lockdown has given a lot of stress to the community, but sometimes it's a bit beneficial too to some of, in some aspect, like the cleaner water, cleaner air. But if you look into the waste management, this has actually bring a lot of bring out a lot of waste in terms of household waste, and as well as the healthcare waste. And I think a lot needs to be done to the healthcare waste. And one of the steps that can be carried out is for the segregation, how we want to dispose the healthcare waste and the household waste. There need to be some sort of sorting being done at home before the collection services come and collect the waste outside. And we can see that this can be in form of the increase in packaging as well as take away food, where this food packaging and plastic waste are a lot in the household. But those waste could also be contaminated, and in that case, we need to do some sort of segregation between those clean or usual household waste and the healthcare waste, where the dispose might be different from one to the other. And sometimes, if you have some contamination being made in with your household waste, you need to keep it at least for 72 hours before you can dispose it for waste collection.
Okay, thank you, Prof. Maybe we move on to Dr. Fadil. Prof. Fadil.
Okay, thank you very much. I think I must share in terms of perspective in terms of sustainability. Those speakers is actually working on those kind of management aspects and how the services is actually try to bring the people's actually the awareness, their level of the awareness. But maybe I can try to make sure that everybody is looking to what exactly happens to us. Okay, if you go to the first what we call that the pandemics be happen to the global networks, right? For example, in February and March, something like that. So actually, people's relatively they don't really care, and maybe they are under the doubtly how to manage that things. So even in Malaysia, in a scenario of Malaysia, I think we don't have that yet in the specific components how to reach out this kind of SOP, something like the SOP. I can give these examples. For example, in high education institution, I think I do believe that many all of us actually are being affected, and most of our students is actually being trapped. They cannot move to other places. In Malaysia, because we have 4 phases of the MCO lockdown. but I'm not so sure to other country. But in Malaysia, we are practicing that things, so means social distancing, so isolated them. So the biggest thing here is the essential services. So in the university right now, what they are doing is actually they actually don't have a proper guidelines actually in order to manage that kind of essential services. For example, on the water utilities, on the waste management, something like that. So what happened? I give you one of the examples. They are trying to do a kind of internal SOP. It means that based on the advice from their own internal institutions. So how to do and how to work with the services from the wastewater management. That's number one. And number two, that we have to understand that once being locked down, isolated, so what happened to the services to other kind of food, something like that, right? So this is also happens to other universities. Actually, they are bringing this kind of system, which means that the student cannot go anywhere. So you have to stay some places, your dormitory, whatever it is. So people will bring these kind of things. So what happened? Instead of we in the higher education, we have a single system to trap all the waste. So what happened is being distributed all over the zone. So means that the waste become greater in different places. So in that kind of services, so people asking, is it safe for them to make it a kind of services ordinary? It means that the old fashions do collection in terms of zoning or timing and something like that. So this is actually what the internal solution being made for that kind of the services, because some of the university in Malaysia, they are managed by themselves, the waste. Some of them is actually depending to the third party. So how this actually been conflicting each other in order to make sure that the services is actually ongoing and it can serve. But for the first phase, I think I do believe that in other higher institutions they're having these kind of problems, because they need to have a good guidelines, SOPs that can actually maintain to safeguard their workers actually. So in other what we call that the international level there, they already stated. So who's actually should be the first frontliner should be actually being advocate and advised to what kind of the standard operation for them to do in that kind of daily operation. So in that case, I think that in the sustainable case, for if you're looking to what's after the pandemic, that's a good benefits, because now on most of the services provider for universities or other maybe local communities, so now they're having the very good system in order to protect not only in terms of the system of managing the waste, but on the hygiene and safe to the workers. Because in certain places, they actually depends to the informal, what we call that, the low level of the staff, which means that they don't have any education on the hygiene and safeguard for themselves. But now I do believe that this is a good way for us look into the future. What happened if we have this kind of system we implement, so we can think that in the future after this pandemic we can have a better system and services. So that's my point of view on the services.
Okay, thank you, Prof. Adil. What about Dr. Siva? Anything to add on?
Okay, thank you, Doctor, for inviting myself. Let me try and give the industrial perspective, lah. Okay, Malaysia went into lockdown on the 18th of March. Prior to that, Quality Alarm has been providing services to the healthcare industry for for the past 5 or more years. Now, we have been servicing all the private hospitals, and we also do help out with the government hospitals. Our staff have been very well trained, and in this COVID-19 situation, let me assure the people outside that our staff have managed to deal with an extra 20% increase in the amount of healthcare waste produced without a single incident of safety issues. So, to put everyone to rest, I think the service providers and the companies in Malaysia have the necessary manpower and also have the necessary professionals to look at making sure that the healthcare service waste management is done in a proper manner. That's a point of view from the industry side. So we handle all the private hospitals waste. Nothing is handled. Everything is transferred into the yellow bins. I'm sure all of you have seen these yellow bins in all the hospitals and clinics that you all approach, and all of this is transferred by containers without any handling, and it's directly sent to the waste treatment centers. Now, on another note, just to give everyone a perspective of how much of waste is being generated on a normal day, the amount of medical or healthcare waste generated is about anywhere between zero point 0.3 to 0.7 kgs per bed per day. From our current records and also from public records, this has gone up by at least about 20 to 25%. So right now we are looking at anywhere about 1 kg on a high side, about 1 kg per bed per day. Now, this is a big volume to handle. It has to be handled very professionally, and we have to ensure that no infection is passed on after the waste is collected and disposed of in a proper manner. So, as far as services is concerned, I think the industry is prepared to deliver whatever service there is in a proper manner.
Okay,
Thank
thank
you.
you, Hasina. Okay, I move on to the next question. Okay, maybe we all already know that maybe we need a new procedure or maybe new SOP because we need to add the additional measures so that all the waste workers are health and safe. But in terms of, do you have any advice or maybe we have to have temporary adjustments on the cities, regions and also private waste collection companies for residual waste collection generated by households or businesses with COVID-19 positive people or people in mandatory quarantine. Because for your information, Mr. Akram, we have like one small city, Simpang Renggam, for example, we have 138 cases recently. This is due to the wedding ceremony that being held before the MCO. So suddenly, maybe many numbers of cases are coming from the same place or small village. So, but the operation of the uh, household collection is still the same. But for example, in Indonesia, the use of face masks from residents was separated and collected by sanitation worker and will be demolished by a third party of hazardous waste processor during this COVID-19. But I think in Malaysia, this is not happening because we are still collecting even at the places with people in mandatory quarantine. I mean that they quarantine themselves at home to be maybe later on finalize whether they are infected or not, but the waste collection is still collected as usual. So what are the opinion or maybe advice or maybe temporary adjustments that we should do to ensure the safety of the waste workers? Maybe Dr. Fauzi can start on this.
Okay, thank you, Prof. Uh, just now, Mr. Siva mentioned about the increase of healthcare waste, about 20%. I think I would like also happily to share that during the MCO, our amount of waste generated is reducing. So generally, they reduce about 10 to 30%. Even in one city, about 30% of the weight has been reduced. This is due to the closure of the some of the activities like industrial, entertainment outlet, and also some commercial and business entities. So as a result, most of the waste is coming from the domestic waste. So this is some a good positive sign, I can say, in terms of effort to reduce the generation of waste. In relation with this COVID-19 related face masks and so on. For us in general waste collection, we still continue to collect waste from the hospital, the dedicated quarantine area by MOF, MOH, and also any areas, affected areas, in which whatever the general waste, the common waste is being collected by us, and the clinical waste is collected by the private entity appointed by MOH and sent to various disposal facilities such as Quality Alam. Um, so actually, related with the face mask used by the public, we together with Ministry of Health, we also introduce the guideline of how to dispose the face mask. For example, the face mask cannot be touched, need to be properly put inside the plastic and then later put into the bin, because we don't want it to be exposed to our workers during handling the waste. In terms of change in our operation, yes, due to this COVID-19, our approach need to be changed. For example, we have to limit the officers that need to go around and look at the works by the contractors, the supervision works. We need to reduce it. So therefore, we are now mainly monitoring the activities of our contractors or our workers is using the remote system, meaning that they are recording through internet, online, and so on. So we have a control center in which all the activities be reported directly after the work done. So the monitoring of the activities at the site now is mainly conducting through remotely. I mean, from our control center. We reduce the amount of workers or personnel to be at the on the ground. At the same time, we also, like I said earlier, in which we introduce, for example, sanitizing our vehicle and equipment, and also public places, in which we want to help to reduce or to avoid infection to the communities. And another thing that worried us now is about the recycling. This is something quite difficult for us now, because although this is if possible, we would like to at least ask people to still practice waste separation and also recycling. Meaning that send the recyclable to the proper places. Due to this MCO, most of the recycling outlet or buyback center has been closed. So as a result, maybe some of the recycling material has go to the landfill. And at the same time, we also need to readjust our awareness program. For example, like the effort to reduce food waste during Ramadan and so on. Because as we all aware that 45% of our waste is a food waste. So the effort to encourage people to try to minimize wastage or try to reduce the food waste still need to be done. But of course, we need to chase the effort instead of direct engagement. Now we need to do a lot of engagement through social media and so on. So generally, uh, for us, some of this initiative we already introduced before MCO. Right? So luckily we have all the facilities and so on. So actually during this MCO, you help us in continuously providing our services. I think that's I would like to share.
Okay.
Okay, thanks.
What about Prof. Adil? Because you mentioned earlier that maybe some of the waste will be conducted by the person in charge at the university. So are they also following all the SOP as the same as the waste workers, because they are not fully trained like the waste workers that normally collect the waste from our house. So they are the person that is the person in charge who collect waste in the university, but are they following the same procedure?
Okay, thank you very much. I think I just want to, before I answer that questions, actually is a very good indicator. Those two kind of categories waste, right, being explained by Mr. Siva on the increment and Dr. Fauzi is about the reduction rate, right? Okay. But in terms of the sustainability, when we talk about the how this will be in the future, because now is the pandemic is still over and over until maybe next year. So the main issue here is about the recycling rate, because the recycling rate in certain part of our region is quite low. Even it's increasing by the awareness program, whatever it is. I do believe that we try to increase that things. That's number one. Number two, that it's not because of the MCO lockdown and because of the safety issue for the workers, something that so we concern about that things. No, the main issue here, because why we are doing the recycling program, why we are doing some reusing program, something like that. Why? Even before the lockdown or the MCO, it because of the responsibility. That's why when we talk about the SDG on the SD under the consumption and production responsibility there, so we are actually much concerned about how much the people is actually been adapting that kind of situation when they are actually not only because of the services and management, but also they are taking care about their health. So the drive factor now for the human being, for the publics as well, is because of this kind of safety issue. Okay, now back to the question. So whether this university is actually implementing those kind of SOPs and hygienic procedures, something like that, it back to the what the best is for the universities. So by now, if I'm not mistaken, we already have a lot of programs, initiative, impact program for the universities to actually to make it a zero waste society in the campus. In the campus. So what happened? Now, because of the MCO, like Dr. Fauzi said, it's been reduced for that kind of particular region or area, a location, something like that. So the part after we actually manage those kind of things, we know that in campuses it's different with the publics and other kind of household. But the main issue here is those categories of waste is not because of the weight, right? Because of, for example, the food waste is kind of being been circulated based on the weights. But on that kind of other category, like masks, like the face shield, those kind of plastics, those kind of containers, still increase. It's still increase. Why? Because we, in order to make a zero waste society, we are making another solution, alternative things. It means plastics. So it's increasing the plastics. So the plastics, because the containers for the food packaging. So for example, like Ramadan, we don't have bazaar Ramadan, but we have the e-bazaar. So people actually will ask for that kind of food or this kind of things from the food delivery, something like that. So they bring this kind of containers, right? And there's some kind of issue also. They said that those kind of food deliver, they must also do a kind of screenings. They must do a kind of safeguard, something like that, in order to protect the others. So means again, to this kind of campuses, higher education center, for example, if they are looking towards to this kind of things, so that's why I said earlier, it is the best time for those actually making for themselves. Means that they don't refer to other third party. They don't do by them by other parties, but they are do by themselves. So they already have their own regulatory process and procedures, but they must be mandated by MOH, means KKM. So these kind of stakeholders must endorse this kind of protection, something like that. So this is the reason why I said so. This pandemic is actually is a wake up call for everybody, because we already have the program, and even we don't notify any kind of infection from COVID-19 to the workers and everything. But beware, another issue here is not only because of the COVID something, it's because of other kind of infection that actually the risk is above the COVID. But people only because of the COVID, so that's making a wake up call for them. So to me, this is the best time to think about future, not only for our higher education, but this is the best place for us to implement the SOP and be sure that everybody will follow that one. That's my comment anyway.
Okay, thank you, Prof. Adil. Because on the recycling matter, it's not just because everyone is still continuing recycle, even though during this COVID-19 season. But we would like to prevent the manual separation because we know that the main sources of infection, isolation, will usually come at the interface between the generator and the handler. So for example, maybe we have to consider the viability of the virus on different surfaces. For example, paper for 24 hours, 3 to 9 days for metals and plastics. So is there any improvement that we should do on the procedure? Maybe we can use it for a long term, not just for this pandemic season, but after this pandemic season also we can use this procedure for a long term towards more sustainable terms of recycling. Can you maybe comment on that, Prof. Razman?
I think before I comment on that, I'd like to chip in to what Dr. Siva and Prof. Fadil stressed just now. One of the things that we see about the concern is more towards the household waste. There's the residual waste that combines with the waste coming from those who are infected by COVID-19 or those are being quarantined mandatory. Because one thing you can see that from healthcare waste perspective is from the institution like the medical institution or from the clinic is already taken care of by quality alarm appropriately. But what we can see is those that come from the household waste, because we are seeing that these household waste are being mixed together with those waste that they came from infected COVID-19 person, as well as those are having a mandatory
Quarantine.
mandatory quarantine. So we can see this actually affect the waste, and without the proper mandate from the government, the business as usual is being carried out for scheduling or for collecting of the waste. So still we did not address the issue of those health, not those waste workers, not the healthcare waste workers, but more on the usual municipal waste workers, since they are going to collect the waste outside 2 or 3 times a week, and they might be infected by the waste that are being removed or being disposed together with the household waste, and this is of concern to us. So here I think they need to have a awareness program to the household to actually separate the waste that they are stored in the house before they put it outside for the collection, because this would actually helps in the maintaining the sustainability of the well-being of the society, or else those waste might be might infect the workers, and the workers then will have like a domino or Pareto incident whereby it would affect the rest of the community and the well-being of the society. So here we need to have a separation of in the household itself. They sort it, and then they can actually make it compulsory to separate those tissues or any the face mask they are using
Glove.
from the household usually has household waste, as well as those that the tissue that is disinfected by a lot of disinfectant that we use, or even when there's a lot of things that is of issue when we talk about COVID-19 positive people. So this need to be done so that when they keep it 72 hours before they remove this, they move it to the collection bin, it helps in the welfare of the collectors. And as well, when they have a procedure to collect it and dispose it separately, whereby those that's been infected might then be separated and then sent to perhaps to the incinerator being used for the medical waste, or being sent to quality alarm control landfill or secure landfill, it helps. So if this has been done, then we can see that it actually helps in reducing the incident or the COVID from being infected to the rest of the rest of the people. And another thing is we need to make the household aware that they don't before we can see they are sometimes disposing or throwing the maybe I'm talking something like the feminine sanitary pad or tissues into the toilet bowls and flush it. And this might go to the sewage treatment plant, and that could actually affect or infected the treatment plant. And now in within this COVID incident or pandemic, if this occurs, they throw their waste into the toilet bowl and flush it, it might disrupt the sewage treatment plant, or even worse, clog the sewer system, and this could actually affect the society at large. So this could be taken care of by educating the household in order not to dispose the waste into the toilet toilet bowls, etc. So I think that's important. And as far as back to your question about the recycling services, I think they need to have some adjustment. I realize that the principle behind this advice is that it's not dangerous for a person to handle their own recyclable in their own house, because they can only contaminate themselves and their families in case they are already sick, in any case exposed to the COVID diseases. But what is in danger here is the source of danger and cause contamination is in the interface between the generator and the people who are going to handle it. Considering that the generator, there is the individual discharging or dispositing their recyclables and waste into a public system, and then the handlers, the waste collector, or the professional who is doing something with these recyclable materials or the residual waste, they might be infected. So this actually need to include the formal waste and recycling system, but also it would affect the informal and semi-formal processing ranging from community or supermarket recycling centers. So if you don't really dispose the waste properly, it would affect, because we send it to the recycling center or to the take back machine or to the low income community who actually have a recycling system involved in as informal street, they might be affected. So some of these processes are directly within the control of the government institution. So we need to actually control it so that it won't affect the masses. And and the other thing, for this reason, they need to have some recommendation focusing on the first instance on supporting those regions or cities by instructing their waste management workers to be clear in identifying the interface and changing their procedure to protect the professionals. And as well giving guidance on immediate required and recommended changes to the interface to protect professional, and giving guidance as well on how to maintain long-term and legal commitment to waste prevention, recycling, and circular economy. So in this context, it is of urgent need to shift our paradigm and clarify the procedures through the interface. So then we can know how the thing can be moved from the generators to the handlers. So this is quite important. And this approach needs not only to the local, but also to the national levels and regional levels, whereby it involves a lot of recycling companies, as this duration of storage and recyclable sets to be considered from the rapidly developing science as regards the duration of viability of the virus that would attach to the different surfaces. That is the papers, the plastics, etc., etc. So they need help procedure. If those to the plastic, it could be 3 to 9 days. So before removing it, they need to store it for 9 days. So in a closed recyclable bag, in particular with dry recyclables for a longer period, at the household before the citizen deliver it to the separation collection center. And then the continuity of waste collection and treatment services must be ensured, as well as meeting with waste minimization and recycling targets, while elaborating on the testing and introducing to the local authorities and the public, as well as the private waste management services, the additional measure to ensure the health and safety of the workers and the public. So I think this is very important for all the stakeholders to know, in order that they can actually prevent the COVID pandemic to continue and become worse. So I think that's part of the thing that we need to do in order to help in the recycling of the waste.
Okay, thank you, Parasman. I have later on I have special question for Dr. Siva, but now I want to ask one more question. Because of the COVID-19 lockdown, whether we like it or not, we may have contributed to unintended side effect of food waste. Maybe Dr. Fauzi can correct me. I think the number or the amount of food waste generating high compared to the normal because of the maybe panic buying, poor planning, food management storage problems, or maybe due to the personal choice and lifestyle, food habits, or lack of cooking skills during COVID-19 lockdown. I'm not sure in India, Mr. Akram, but in Malaysia, we tend to try all the recipes online, and there are so many failed cooking attempts that might contributed to the food waste generation. So maybe Dr. Fauzi, you can suggest or recommend a more sustainable method to handle the food waste management at home, and maybe this is the right time to introduce and also make all the food waste management at home to be handled by the owner themselves. Okay,
Excellent.
maybe Dr. Fauzi can comment on this.
Yeah. Okay. In relation with the food waste, actually at early part of MCO, I mean the first few days, we have a problem of food waste disposal because some of our food produced at the farm not able to go to the market due to some earlier problem, adjustment and so on. This is happened at where area the food or the vegetable is coming from lah, in our country. So but now is okay already lah, already stable. Okay, without COVID-19, actually during Ramadan or during any festival or festive season, we can see about 15 to 20% increase of food waste during without COVID. So this due to this COVID, I'm not sure what is the trend or the pattern of the food waste because now people tend to cook themselves. Maybe they're not eating outside. I don't know. Maybe they can have a lot of savings. Due to this COVID, we are not able to conduct our waste composition studies. So anyway, we will try to maybe as from COP, we try to look at whatever data that we have during this COVID, the last few months and several weeks, so that we can look at the trend and see how this food waste pattern during the MCOs. But in general, it is encouraged, it is advisable to try to minimize the reduction of food waste because as I mentioned earlier, 45% of our waste is a food waste. It is essential for us to try to reduce this percentage and try to avoid mismanagement of food waste. Just to inform you, the members and the public, actually we as RUCOP, I mean my previous agencies, and with together with Scuba Universities, JAKIM, UTM, we the last several months or 1 years, we have conduct several studies. We call it reduction of food waste by faith. Meaning that try to make people aware that uh, avoiding the food waste, avoiding wastage is a good practice of most of the religious faiths or requirement. So through this initiative with the several communities, we can see very good and positive impact. In which in some area we managed to reduce about up to 48% of the food waste normally generated. So we hope that this initiative or awareness program is still be continue and the awareness program engagement with the people need to be further continue to be continuous and enhanced so that the awareness in waste reduction especially on the food waste could be increased. And in related with the recycling, actually we are also worried due to this COVID-19, our recycling rate will be, I mean, cannot, will be lower, especially on the plastic. As you all aware that our crude oil price is low, so usually it could impact our recycling activities because more manufacturers are using virgin oil to manufacture their plastic, not depending on the recyclable resin. So this is another challenge that we need to focus on, to address. And like mentioned by other panel just now, in terms of the health impact to the workers of collecting the recyclable, because currently most of the recyclable is being collected by hand, meaning that is manually. So we are maybe try to think of collecting the recyclable using the same method as a residual waste, meaning that using bin lifter and also compactor, and after that this recyclable is automatically or mechanically sorted at the MRF, or material recovery facilities, not as what we are doing now, meaning doing it manually. But of course, this is depend on engagement with the Ministry of Health on how the risk, the possibility of infections through this collecting of the recyclable. So of course, our effort in waste reduction, recycling, and also food waste cannot be stopped because of the COVID-19. We still need to continue. That's all I would like to share.
Okay, maybe Prof. Fadil, you can comment a bit on, maybe I think this is the turning point for us to practice composting at home to cater our food waste. Because because Prof. Fadil is normally going to Japan for all the activities, and then they also practicing composting in Japan. Maybe now is the right time, or maybe this is the turning point for us Malaysian to manage our own food waste at home by doing composting maybe.
Okay, I think I shall agree with a few points, actually, Prof. Razman and also Dr. Fauzi mentioning about those kind of waste composition and those kind of services that actually running out by now. Another part that we have to consider in this waste management system, as at this time until today, there is no such reports incidents actually been connecting COVID-19 with waste, something like that. There is no incident. Even for wastewater, people actually found out that the RNA of that kind of viruses being detected in wastewater, but still is very inactive, right? That's the best point for all the workers and something related to that kind of downstream process. So it means that by now, COVID-19 is actually, I can say that it's not been affecting at all the ordinary fashion for those kind of services for the waste management. That's number one. But actually, what we have to be cautious here, right? The main concern by in terms of our responsibility for that kind of waste, because Malaysia, for example, Akram, because we are trying to make a kind of awareness to the publics that 45% mentioned by Dr. Fauzi there is actually waste that can be recycled. Means that you don't have to throw it. You have to keep it by yourself and make it a kind of process, urban farming, whatever it is, a composting. I think that one is actually today is people not because the COVID and not because of the compost, but because of the COVID, they're cautious. The risk is actually they just mentioned by myth, something like that. They say that this may be infection for them, but actually it because of the trigger factors from the COVID. That's number one, 45%. So what how about the others, 55% or maybe 40% out of that kind of other materials that actually part of that, 50% of that can be also reduced significantly because in previous years, and I think in a few years, we are practicing two things. The first is separating your waste at home, something like that. The second one is minimization of waste, something like that. If you can do these things, so the end up the downstream process for that kind of thing will be reduced dramatically. But this is the things that we have to bear in mind again, because in this system, services it's correlated each other in terms of the cost investment, in terms of the maintenance, in terms of those kind of service provider that can actually working on that. So in that kind of system, if we are looking into the biocompost, for example, right? So people actually maybe after this, we have to think until maybe next year. So what will happen when the people is actually everyone can cook, for example. Before this, they actually just buy from the cafes. They just bring back to the home. Then they have a leftover because they just eat whatever they just see. But nowadays they can control their foods because they have a kind of storage, enough storage. So that's it. So means that they control. So minimize is happen now. It's happening to separate the things. So this is another portion. To separate means between the organic waste and the non-organic waste. So this is actually what we have to do now when we are making a reports and documentation in terms of making the people actually aware out there. Please, actually, not because of the COVID, you can actually separate and try to do by yourself. Even you can make it a bucket of your wastewater every week. You can also maintain, and maybe you can sell that one. So that's we call it circular economy. So this is actually EU already practicing a few years, but Malaysia we don't have that kind of circular economy yet. But we have to do by now because the COVID-19 is actually, as I said earlier, is a trigger factors. So then another factors that we have to convincing to other publics here is it's not because of the infections, it's because of your responsibility to make sure that people out there that actually working for you actually safe also. So give them is actually a good sign, something like that. Okay, if you separate these things, so means that you also protect the workers there. So to me, it's actually you kill birds in one stone, for example, two birds in one stone, right? So that's my comment anyway.
Okay, I just want
Okay.
to come in.
Okay, we have one more question for Dr. Siva. Because we know that on the healthcare waste, we have Agenta, Medivest, Redicare, and Quality Alam. So, is there any maybe extra precaution for Quality Alam workers when dealing with healthcare during this COVID-19?
Thank you, Doctor. Like I said earlier, we have already implemented our safety program with our workers, and we also have a program with the hospital workers. So if you look at the waste generation value chain, the first is the waste generator. So the waste generator in this case being healthcare is the hospital workers themselves. And what we do is we have a program with each and every hospital, which is done by Quality Alarm to every hospital that we service, is to run a refresher course with them twice a year to teach them and give them the awareness on how to handle medical waste or healthcare waste. So that way we ensure that the workers in the hospital know how to handle the healthcare waste in the proper manner. Now, beyond that, it comes into the collection phase. Now, that collection phase is always handled by Quality Alarm itself, and our workers are very well trained and they go through standard SOPs, which then ensure um, these kind of outbreaks, whether it's COVID-19 or whether it's anything else, does not get transmitted beyond the hospital borders. And once it comes into our facilities, there is no more hand handling of any of these types of waste. Now, I just want to go back to one step earlier to one of your questions. Actually, if you look at even municipal solid waste, so your question is now was on healthcare waste. Even in municipal solid waste, um, the question about recycling is an individual question. So the people have the responsibilities in recycling, which in Malaysia is still very low, and it needs to be increased through awareness, training, so many other things. But yes, so far in the last few years, it is coming up. But the point is this: the system put in by the Solid Waste Corporation and also the National Solid Waste Department is very simple. It had all the waste that comes out to the bins are supposed not to be touched. So there are bin lifters, there are dump trucks, which ensures the workers' safety. So these measures have been put in prior to even COVID starting. So this is where I like to say the waste industry, I think, is well versed. And like what Prof. Adil said, there is no case so far to show COVID-19 and waste management. So my assurance to the public or to anyone who's listening is, um, the waste management and the healthcare waste management, as far as quality alarm is concerned, we are very well prepared to handle whether it's this pandemic or any other pandemic. The SOPs are there, and we will ensure that our services to the public is always of the top notch. Thank you.
Okay.
Thank you. Yeah, thank you so much, Dr. Eslina. Wonderfully conducted and wonderfully moderated, in fact. And I think today I got an opportunity to listen to the issue because I don't come from the environmental background. So I was just thinking and introspecting that this is not the ultimate aim of organizing this series of webinars. What is it that we are going to look into? And when I was listening very patiently, I found Dr. Fadil giving a very background that zero waste country. Now we got an agenda here, very clear that the moment you said that, I spoke to the state government of Chhattisgarh. It's an Indian state and mostly polluted, and the mayor of that state, I just got connected and I proposed that we will develop a proposal. We are connecting with 200 environmentalists from across the world and 200 businessmen, and we want to make your state Chhattisgarh a zero waste state. And then same proposal we will reach out to many other states and the central government of India and many other governments across the world. And then we can also reach out to United Nations for the SDGs. I think we can propose this kind of proposal out of those. So all the discussion points that are coming out of this is really helpful. I think we can develop a roadmap or a SOP that we were talking, a customized. So one would be a standardized SOPs, and the other format would be customized SOP for any state, for any country to make it a zero waste nation. So I think that is what I got as an outcome from this discussion. So thank you so much. I think from now on we will develop a proposal. We'll reach out to the respective governments on that. So with this note, I would like to thank each one of you for being part of this wonderful discussion. Viewers, we will be back again next week, same time and same day, with another set of experts giving a discussion point on a different angle. Thank you. Keep watching the Policy Times.
Thank you very much, Akram, and also the rest.
Thank you.
Okay, thank you
Thank you.
everyone.
Thank you very much.
Thank you.
Thank you. Thank you.
Thank you. Thank you.
The back end is going on.